Alright, ready? So what we would like to do is sweep, sweep, sweep. Good girl. Sweep. Good girl. Very good. And what I'm doing is I'm just using the thumb to actually sweep the top, the cheek, on the inside, and that's what I would like to see her do more biting. So I'm sweeping on the side because usually if you're eating food, you may not really notice it, but when you're actually chewing, you have a tendency to move your tongue. I want her tongue to follow. Okay, I would like her tongue to follow, which she did a little bit. Yeah, so I'm really sweeping. Good girl, good girl. Good girl. What will also be very good for you to do is also use maybe like different sauces that you want to try with her initially. You're doing this first as a stem, but you may want to start putting little drops of the sauces that you may try, or different flavored mashed food on here, so she can start to actually get more of the flavor, and she's getting all that stimulation at once. She's getting the tactile stimulation. She's getting a little bit of deep pressure orally, as well as she's getting the one of the 3 T's, which is taste. Okay, very, very important. Okay, so she did well with that. Now I like the way she just has that tongue out there. I'm going to sweep the tongue from back to front. Good girl. Good girl. Good girl. So I'm basically going back and forth like this, from about the middle of her tongue to the end. Good girl. Good girl, sweetie. Ready? I think this is your favorite. I always like to start off with things that I know she really likes. Yeah, I know. My goodness, isn't that yummy? Yummy, yummy. Ella. Ella. Good girl. Good looking. Good looking. Good looking. Good girl. Oh, you see that string, huh? What is mommy doing with that string? More? Ah, very good. It's like, I want more. And this is a little warm. Okay, what I'm doing is I'm sweeping this way, and then I'm sweeping this way. So I'm starting at the roof of the mouth and sweeping around her cheek to her tongue. I go the other way.
Okay.
The exact same way, and then I bring the stroke out on her tongue. Okay. So I think she's tolerating this very, very well. Okay. We start her off, of course, with the outside stimulation and worked our way into the oral stem inside of her mouth. Okay, so she did really, really good with that. That was wonderful. Now, this is a good time too I know she's liking the way that tastes, but even if she can focus on watching you eat something as well. A lot of times babies pick up on a lot of social things. It would be great for her to also learn imitation, and for her to be somewhat observant, which for her age is great. That's going to help even later on cognitively as she's developing language. So you want her to try to imitate too, as much as she see you guys doing it, and be in a social environment when she's seeing you guys eat, which is great. That's really great. So is she typically sitting down when you guys are eating? Remember, eventually we want to move her away from some of the baby food too. So remember, we're going to season the baby food.
Okay.
Remember? So not so much she would want the more nutritious things. We want things to be flavorful to her because she want to encourage her to eat. We want to entice her to eat. Okay? So we're still putting just a little bit of something extra in her baby food.
Okay.
Because remember, we're working on increasing her oral awareness as much as possible.
Taste,
texture, and temperature. So right now, I'm not so concerned about cold, not at this very moment, maybe another few weeks, couple of weeks or so. Right now, I'm just really interested in her getting more of a flavorful variety of food and different types of texture. The coordinated chew is not going to come until she really crawls well. Until she really starts to crawl really, really well, she's not going to have a good coordinated chew, but we're getting her prepared for that because we're trying to wake up the awareness in her mouth right now. Okay. So as she does really, really well with Sherry, with all of her growth motor skills, she's going to do so much better when it comes to eating, chewing when she's eating, and speech later, with her language skills later. Growth motor has to really come first. She has to really master her growth motor skills first, physical therapy, and then she will become better with her other fine motor skills, which her tongue is a fine motor or a smaller muscle group, where she will learn exactly how to coordinate her pattern of chew and her language. Okay? So, let's get her a biscuit, Mommy.
Okay.
How she has that cookie in her mouth. When she puts it in, you notice that she puts almost half of the cookie in her mouth. You notice that initially? That's because first of all, she's trying to figure out exactly where it is in her mouth. So that's because she doesn't have the oral awareness that I'm talking about, meaning that she doesn't have a good feel in her mouth. So she may have a tendency to stuff her mouth. Okay, when you realize that she isn't sticking it so far back, or she doesn't feel like you don't see her stuffing her mouth, because she's gonna do that. That means that she still has low oral awareness, but when she doesn't do it as much, that means her awareness is picking up. Okay, and that's how you will know that she's getting better. Those are the things you'll be able to tell. Just give her time to play with that for a bit. So yes, even if, like I said, even if she has a little bit of formula after, but while you guys are eating, that's great. You're allowing her to eat things off your plate. That's wonderful. Have you tried any strips of beef or strips of pork or any strips of chicken that's a little firm, where while you guys are eating strips of meat, she can have the opportunity to eat strips of meat as well? Well, she won't eat it, but at least give her the opportunity to kind of gnaw on it and taste the flavor of the food. Yes. Just to let her have the opportunity to explore the food just with her hands and mouth. Strips maybe about that long. Maybe about that long. Just to give her the opportunity to take that strip. So she can because that's what she's really trying to do with that cookie. She's trying to put it on the side there, to have a little bit more discriminatory type of play with the cookie, or even with the veggie stick. She's trying to have that little play, but the thing about the meat is it's a chewy, but she can't really chew it, but she has the flavor, she has the texture in her mouth. Okay? Which is what we're working on.
Okay.
We really don't want her to eat it so much, not a strip, because she can't bite it off, but just to give her that exposure, the opportunity to start exploring that another type of food in her mouth. Oh my goodness, what to do? So many choices. What are we going to have, Ella? You still prefer that thumb. Did you see it? Where'd it go? Oh, it hit the floor. What about this one, Ella? Added just a little bit of the cookie just to see the biscuit just to see how she would tolerate it, and I've thickened it up just a little bit more. I'm grating it up just to see how much she can tolerate right now. And she's already eaten rice. I think she's gonna be fine. You're playing. You're not really chewing right now. Yummy. And that's what you want. You want her mouth to close, and she tries to chew. Very important. So you notice the thicker the texture, the better she does. So I'm going to write down the Ritz crackers.